It is very important to go to a center that will teach you not only to be a humanistic doctor and an ethical doctor, which is very important, but one that will give you the skills to enable you to continuously learn beyond the medical school. The best doctors and the best careers are those that build one day and one patient upon the next. And research is such an important component of that because it helps you understand how to think and how to apply what you know to the given patient and to ask the right questions to go on and become the best doctor and the best advocate for your patient. The only way to do that is to go to a school that forces you to think, to ask questions, to probe, and to make you to be the best person that you can be so that you can be the best doctor, so you can help as many patients as possible.
So I would say to students that are choosing medical school to choose it for the right reason. So the right reason to go to medical school is because you like to have a profession that you interact with people all the time and that you are interested in improving human life, improving the quality of life, alleviating pain, and prolonging life with the understanding that birth is associated with death. So we want to prolong life, but most importantly, we want to prolong good quality of life for a long term. So as long as they have in their mind that they're entering the school with a way to improve the life on earth for human beings, I think they're going to be happy with that choice. If they're entering medical school for other reasons, they will find their choice to be problematic because financial reimbursement, it's okay in medicine, but it's not going to make you rich, and certainly that's not the gratitude that you get from this profession. It's more the gratitude that you get by treating patients and see that you have been able to contribute positively in their lives.
The suggestion is quite easy, in my opinion. I think that every activity, not every work in any part of the world has to be approached with brain and heart. My father, radiologist, used to say, the day when you will reach your place of work in the early morning, saying, oh my dear, I have one more day of work, that day means that you have to change something in your life. You cannot approach your daily work saying, oh, one more day of work. So the suggestion is whatever medical activity a doctor chooses, to try to approach it in the deepest way, not only studying, but also trying to get fond of the work, to be fond of the work. Otherwise, that day mentioned by my father will arrive very early, very soon. So it's important to love the work because our work takes most of our weekly time. So it's important that we love our work.
What they need to do is speak with students at the school. They need to go to the school or call to the school or somehow communicate to the school and ask, may I speak to someone who's in the class? Someone that's near their peer, in other words, just a few years older. And ask that student, can I talk with you candidly, confidentially? What do you think of the school? Tell me the truth. Tell me what I really need to know about this institution. And usually that student will be candid with you. And I would rely very heavily on that information, especially if I got several pieces of that information from several students. That would be reliable information for me. I would be asking them, what should I do to improve my chance? What do I need to know? What do you wish you would have known when you were at my stage? If that means taking more classes, if that means shadowing other physicians, whatever advice they might give, that's probably pretty accurate because they're now involved in it. So I would always look, as I did throughout my career, to the person that preceded me be it a professor, an advisor, or a student, and say, what do I need to know that you didn't know or you wish I would know? Most students don't ask the question often enough. They don't ask. I would say they wish they knew something, but they don't ask for what they really want. And they don't quite understand why they're not getting information that's accurate. It's because they haven't framed the question well, or they haven't really asked the question. If they ask, they will then be given the advice, because people are very happy to provide advice if asked. Many people like to help.